Hi everyone, I'm Dr. Paul Fortes. I'm one of the plastic surgeons at ACPS, and I'm going to be addressing questions about Mommy Makeover. I would say that you need to allow the body to recover from the state of pregnancy before embarking on a Mommy Makeover. So I would say about 3 months at the earliest, and in most cases, probably 6 months. In a Mommy Makeover, it's actually common to do combination procedures. So those common things include breast work with body work, including abdominoplasty, maybe liposuction, breast lift, and maybe breast lift combined with breast augmentation. So it's a number of different things that can be combined to create the customized Mommy Makeover. Well, anytime a pregnancy happens, the body will change physically and physiologically. So if you've had a tummy tuck, it's not impossible to get pregnant. As a matter of fact, pregnancy will happen and will happen normally, but the tummy probably will get stretched again and the muscles in the skin will get stretched again. I've seen patients, however, who have had a Mommy Makeover with tummy tucks, have had a pregnancy afterward and who have bounced back and looked pretty good. Now, for the ones that may need a little bit of a tweak, that's possible too. I would say to patients, expect about a 6 to 8 week recovery to return to most normal activities, probably with the exception of intense workouts. And with intense workouts, including abdomen exercises, we're talking about 3 to 6 months. But everything else, probably by 6 to 8 weeks, you're good to go. A lot of that depends on how old and how big your kids are. I think it's probably best to wait a 6 to 8 week period before doing any heavy lifting. So, keep that in mind when determining when it's the right time to lift your child. It depends on the work that you do. I usually say to patients, expect about 2 to 3 weeks before returning to driving. Once you're able to drive, you can drive yourself to work and do a kind of work that is primarily desk-type jobs. If it's anything more physically demanding, then I would say wait at least a month to a month and a half. Well, with a tummy tuck, the excess skin that's trimmed away will remove those stretch marks that are located within the area of skin removal. The remaining stretch marks actually will get pulled down, so they may be less noticeable. They may get flattened a little bit, so again, made to look a little bit less noticeable. But it's just that the stretch marks that are located in the skin that's being removed that will be corrected.
If I'm a good candidate,
I would say the vast majority of women who have gone through a full-term pregnancy will experience some changes related to the pregnancy and breastfeeding period too. And that includes looseness of the abdomen, skin and muscles, and maybe looseness of the skin of the breast with some degree of laxity and droop of the breasts. So if any of those things are things that are noticed, they can be fixed.